Hello and welcome to the Headache Doctor podcast, where on this podcast, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. In today's podcast, I have two really exciting guests that reached out to me originally, I believe, because we're in a similar space. And so this is Kim and Holly, and they're licensed massage therapists. I'll let them introduce themselves, but they've got a fascinating backstory because they are entering into this world of headaches and migraines and seeing some incredible results. And so I'm excited to jump into this. Kim, why don't we start with you? Tell us a little bit about yourself.
Sure. My name is Kim Sherlock, and I live and work in Westchester, Pennsylvania. And I was introduced to this work in 2007. I was just a mom. I had no background in anything medical, PT, whatsoever. But I was sitting at a sports event with another mom, and she was telling me about her son who had seen Dr. Gillespie, who was the founder of this work, Barry Gillespie. And he had been resolved from all of his issues with asthma and learning issues and behavioral issues, so much so that the teachers had called and said, "What has happened? We see this profound change with your son." So as she was saying this, she said, I took his class. My sisters are taking this class. You should take it. And I wasn't quite sure why she was saying this to me with no background, but I think she was saying this from one mom to another. And I loved the idea of natural health and wellness. She knew that about me. So I went to this training and I loved it. And so many like-minded people. And Barry and I became friends. And I started to just practice on friends and family, and things started happening for them. And they started telling their friends and family. And so this thing kind of grew for me. And I decided to go to massage school at that point, which never in a million years did I think I would do that in my life. But I would put the kids on the bus. I would go to school myself. I would come home. And, I did this as long as it took to get that piece of paper to become a licensed massage therapist so that I could specialize and practice this work. And I've been doing that for, since that time. I guess it was around 2010 or 11, I completed all of that and started helping Barry with his classes and getting his information out into the world, getting him on the internet, introducing him to Facebook, all those things back then in 2011, 2012. And the work started to grow, and we started to get requests from all over the world for us to come teach. And as he was kind of hedging on traveling and teaching, I had said to him at one point, we can't expect the world to come to Philadelphia, or, we need to be able to go out and teach this class. And so at that point, Holly and I and Barry sat down and we came up with the plan that we were going to carry on the teaching torch. And Holly and I have been doing that. And we've been, traveled the world and traveled throughout the US every month. And we've seen this really nice growth from grassroots, really, of this work because, frankly, it works.
Yeah, that's amazing. And what we're talking about here is craniosacral fascial therapy, CFT,
Yes.
and that's how you've
Yes.
branded it. Is that correct?
Yes, and it's the Gillespie approach. So
The
it's Barry
Gillespie approach,
Gillespie's
yeah.
work that he developed. We can talk more about exactly what the work is, but
Yeah.
yes, it's a lot of words. Craniosacral fascial therapy, it gets confused a lot with craniosacral therapy or myofascial release. It's a combination of those
Yeah.
therapies. And so for short, we call it CFT.
CFT. All right, Holly, what's your story?
Okay, here I am. Well, I am sitting in the jungle of Costa Rica. It's very hot, so if you see me wiping my face off, it's because I'm sweating. My name is Holly Steflik, and I've been a licensed massage therapist since 1996, but interested in alternative health and wellness my whole life. And so over the years I was in practice, I practiced a lot of different body work modalities, and then specialized in a type of energetic body work and was teaching that for many years. And in that time period, I met a gentleman who had a center for brain injured kids in Philly, and Barry worked there for quite some time. And so this gentleman told me about CFT and the Gillespie approach back in 2005, and I heard about it and thought it was interesting, but of course it was just another thing to go learn. And then it was in 2013 that I got reintroduced to it again through a mom who wrote a testimonial about her 2-year-old son who was failing to meet his developmental milestones. They took him to the center in Philly, and he saw Dr. Gillespie, and he slept through the night for the first time. And so because I really respected this mom and knew that she probably had exhausted everything else before she went down that path, I thought, okay, well, I want to check this out. So long story short, I went and took the training, and I became good friends with Barry, and then of course met up with Kim. And eventually my practice just turned into CFT. People just started hearing about it. There was such a need with, infants and children and adults, and everybody just started coming, and my practice just turned into CFT. And then, like Kim said, back in, I think 2015, when Barry decided he didn't really want to travel anymore, we got together back then. And so we've been on the road for almost 10 years together, traveling and teaching CFT. And it's really grown as a very, grassroots modality. And it's kind of taking off. It's really fun to see it and be in this 10 years from now. We used to go out and teach, 6 or 7 people. We'd fly to California, teach a few people, leave for, 5-6 days. And, now we have these trainings every month that are full and have waiting lists, and it's really exciting to see it grow and people learning it.
That's fantastic. Why don't you guys give us sort of an overarching view, where Dr. Gillespie, like what he was seeing when this initially started and the approach behind it. I guess the question I typically ask is what was the area of healthcare that felt like these individuals weren't being served well? And then how did this approach seem to like fit into that? You've mentioned different, whether it was like the developmental milestones or different things that this treatment can be effective for. But what was like the origin of this that he was seeing that, oh, this is the problem and this is what I think will work to correct it?
So Barry was a periodontist in the 70s. He was a periodontist up in the New England area, and he had a young family, and he suffered from headaches, and he suffered from TMJ. He was a sickly child. He talks about having asthma, having taken a lot of antibiotics and penicillin growing up. And so this was catching up to him, and he went around to all of the medical establishments in the area in search of helping him with these headaches and TMJ issues, and nobody could give him any answers. They just kept saying, you're a young father, you have a growing practice, and they attribute it to stress. How many times do we hear that?
Yeah.
Until he went to a chiropractor and they told him something he had never heard, which is that his cranial bones were restricted. And so he started to get some work with the osteopaths in that region. And for the first time, he started to feel better. So he knew he was onto something. So he started training with the osteopaths, and he was bringing it back into his practice. So he started practicing on his patients. And all of a sudden, their symptoms of headaches and TMJ and asthma and certain conditions, nervous system regulation, was all starting to create positive results for them. Now, as a dentist in that area, and at that time, he really wasn't supposed to be doing this type of body work. And he left that area. And so he came down to the Philadelphia region, and he met up with John Barnes, who is a very well-known teacher of myofascial release, a different type of therapy. He was working with John in his clinic. He went to massage school, which always cracks me up that after all that work to become a periodontist, he went to massage school, and he started just teaching this work one by one and building this work in a way that, again, was very organic. So he was able to take what he learned from the cranial osteopaths, from John Barnes in the myofascial release realm, and then what he knew as a dentist with all of the oral structures, understanding that all of the oral structures are also encased in fascia, everything under the tongue ties, the lip ties, the teeth. And so combining these 3 areas, he developed craniosacral fascial therapy. And so that's kind of where it's rooted. It's rooted with Barry, with his own experience, searching for his own healing in the world of dentistry, really.
Wow. Okay. All right. And so it sounds like this spans from from anywhere from like a newborn to adults. So there's application in all types of individuals and different different types of symptoms that pop up. But it sounds like there's maybe a focus on the head and the face, neck, jaw, tongue mobility. Is that correct?
Well, I think, why don't I give an overview of kind of the combination of those two modalities? I think it
Absolutely.
will help.
Let's do it.
Yeah, the listeners kind of understand. So if you think of craniosacral therapy, the brain, the cranial nerves, the cerebral spinal fluid, the spinal cord, that's all encased in fascia, and that's sitting in the fascial web. So Barry was studying with the osteopaths craniosacral therapy. He was also studying myofascial release, and then he started to use these coming up and blending these techniques with his clients who were having a lot of craniodental strain. And so he was saying, well, you can't really separate out I'm hearing feedback. Are you guys hearing that?
I think you're okay.
Okay. He said you can't really separate out the craniosacral system from the fascial web because it sits in there. And so that's what we're doing is we are addressing the fascial strain that pulls on and into the craniosacral system, the nervous system, the brain, the cranial nerves. So not only are we affecting symptoms and conditions of the fascial web, but we're also affecting nervous system. So we're addressing all of that. And then, of course, all of the craniodental strain, which we all have a lot of, and a lot of people don't have that awareness of that craniodental strain that could be part of migraines and headaches. They're not thinking of that as part of the picture. So that's kind of an overview of what CFT is. So we are always, when we are working on somebody, we always have a hand either on the occiput or the sacrum, which is our kind of tap into the craniosacral system. And then we have another hand out in the fascial web. And we are asking, is there fascial strain between our two hands in relationship to these two systems? And then we are allowing the body to unwind that fascial strain, and we're following that. So it's led by the individual. In infants, we call it infant-driven movement. So it's a very gentle work, and it's very safe to use on pretty much any population. From infants, we work on newborns up to elderly people that can't lay on a massage table.
What are some of the primary symptoms that people are coming to you with? I'm assuming that they're finding you because they're having something like a headache or jaw pain, or is this sort of you can really take anyone and flesh out some of these things because just having a body kind of qualifies you to need to unwind some of this.
Yeah. You want to answer that, Kim?
So yes, typically someone will come to us with some kind of an issue that they're having.
Okay.
Headaches are a big one. Migraines are a big one. Concussion type symptoms is another. They're probably the top three things that I see outside of working with infants. If we wind back to infants, they're usually showing up. First red flag might be a problem with the latch, or the baby's crying all the time. They're fussy, they're constipated, all those kind of baby issues. In kids, we might see things like headaches. We're still seeing kids with headaches, concussions, learning issues, nervous system regulation. They don't sleep well. They're not going to the bathroom well, all those digestive type of issues. So it runs the gamut, and it runs all ages. So I know that your audience is kind of specifically tuned in to learn about headaches and migraines. And so that is a very big condition that we see. And sometimes that is kind of an, oh, by the way, I have headaches, because they're even coming with some other kind of a problem. So I think people get so accustomed to living with headaches or migraines and trying to just work around them that they don't actually know that there is something that can get to the root and get to the core to help them release the tightness in their system and relieve them of the pain that they have to live with.
Yeah, I love the approach as far as looking at the entire system, head to toe. When it comes to the infant stage, you mentioned not being able to latch. You've mentioned tongue ties. Can you talk about the implication of the things you see in that infant population, and if it goes untreated, what that might mean for them as an adult?
It's the longest list, and it's every single person that comes into your office. Yes. So when we can get those babies unwound and get them to a pretty neutral place, because babies are in a small space, right, for a long period of time. So things are really tight. And then if they come out and they have any other conditions going on, so if they have any kind of oral restrictions, tongue ties, lip ties, any head molding issues from being in a tight place, from positional strain in utero, then we want to start to clean all of that up the best we can so that we can get to a blank slate, so that we can set the trajectory for them to go into their childhood, their teenage years and adulthood without that. But one of the things that we see is, of course, is oral restrictions, tongue ties, lip ties, that when they go undiagnosed and untreated do contribute to a lot of conditions later down the line when we see the 40, 50, 60-year-olds on CPAP machines, high blood pressure, all kinds of medications. And they have really poor airways because they developed poorly because of the position of the tongue. So that's really what we see is, every kind of condition that you can imagine, nervous system regulation, ADD, sleep issues, digestion, headaches, everything. And we can start to pull that apart and look at the structure of the whole cranial dental system of the whole body. And we can start to see, dial it all the way back to infancy and talk about some of those things. A lot of times people don't know, a lot about their birth, but we can kind of piece together what the story looked like for them. So we just get so excited when we can help an infant and a baby avoid, the migraines, the TMJ, the headaches, the anxiety, the depression, all that stuff.
Yeah, that's amazing. Are you guys connecting with maybe dentists that are performing the tongue tie releases, or are you seeing a restricted tongue and able to loosen that in some sense? Is there a combination there, or when you see a tongue tie, do you refer out and then you work with them kind of around the procedure itself?
Yeah, we're always collaborating and working as a team. So we have seen enough babies and enough ties in our experience. However, we are not able to diagnose them within our scope. So, our language, we're very careful with our language, and parents don't know. And they've been told many different things up until the point where they've come to us a lot of times. So we have relationships and we encourage our practitioners who are learning to develop relationships with airway center dentists, particularly those if they're working with infants who are working with infants, and we collaborate with them. We also collaborate with the lactation consultants because they're part of that team too. And then if we're talking about people who are a little bit older and they're either children or adults, then we may bring in a myofunctional therapist, which is a therapy that helps the mouth. It's kind of like PT for the mouth to help the tongue know what to do and how to work all the orofacial muscles in the correct way, because we're all just compensating with what we have. So it's really nice to have that team approach. What we like to do, particularly, let's say we have an infant and there's a suspected tie, is we want to work with that baby, cleaning up, I say, all of that tightness in the mouth, helping their nervous system regulate. That little tie is just the tip of the iceberg. Underneath it is a lot of strain that we want to help that baby work out to. Up until the point, if there is a true tie, then we send them to the dentist. The dentist will do a release, and then we want to see that baby after to help them with any residual strain. And that is the most beautiful outcome when we can work that way. And a lot of times parents, they don't know, and they go to the dentist and the dentist says, there's a tie, and they release it right there. And it's just like, if we had only had just maybe a couple sessions ahead of time, we think that most outcomes would be better. But so we do not release tongue ties, but we can release, there's tightness all around that tie. And that's what we're working on trying to clear up before they head out to the dentist.
Yeah, that's fantastic. When it comes to adults, can you paint the picture of what someone with a headache or a migraine might experience coming to work with one of you or a provider that's trained in CFT? I think when someone's listening to a provider that has a new approach, a new technique, people have tried everything, and I'm sure you guys interact with people that say, I've exhausted all my options and I feel like I'm at the end of my rope. And so sort of picturing what this actually looks like. Can you guys paint that picture for us?
Sure. Yeah, we do see all those kind of people. And what we say is we know that if fascial strain is a part of the condition that they're experiencing, then we're going to be able to address it with CFT. So CFT may be a piece of the, the missing piece. And it just depends. But, we're also looking at the whole web, the whole fascial web. So when you put in a kink into that fascial web, you're affecting everything. So I know that people get really focused on, location of pain, but oftentimes, it's where you think it is. It isn't, we're going to somewhere else in the body. So we're really looking at the whole body, the whole fascial web when we're addressing somebody. We have a way of checking the sort of the if the system is open by something called the brain cycle. We didn't really talk about that yet, but the brain cycle is something that Barry expanded on the 6 to 10 cycle that we listened to in craniosacral therapy. And what he found was there was a longer tide or a longer wave or a longer cycle when he got somebody's fascial web open. And he knew as he was counting that, he would say, okay, if we count expansion and contraction, that cerebral spinal fluid should be opening and opening and opening. And we should get to 100, 200 seconds in each phase. And so when we put our hands on somebody and we listen for their brain cycle, and it's a very low number, let's say a 10 or 20, we know that we're going to make a difference for them right away. Regardless of whether we're curing their migraines or their headaches, we're going to get that system open and get things starting to flow. So that's actually kind of like is a hopeful thing when you come and you get somebody who's got a brain cycle of 0, could be from just their whole life. They've been going around that way. They've had concussions, they've had braces, they clench and grind, they, have apnea. And a lot of those, seizures, all those things take us back. And so we're opening up that cycle to address things. But what was your question? I think I got sidetracked off.
Yeah, paint a picture of what would actually happen. So someone comes to you, they say, I've had migraines for 10 or 20 years.
Yeah.
What would that look like?
Yeah. Well, so when anybody's having any kind of acute situation, that sounds like a chronic situation, but we want to see them at a regular, time period, because we know that if we give CFT 3, 4, 5, 6 sessions and we're not making a dent in it, then we know that maybe it's helping with other things. And sometimes people need to be clued into that because they're so focused on their one symptom that you say, well, actually, what's the intensity of it? Oh, it's not a 7 anymore. It's a 4. Okay. How many times a week are you having migraines? Oh, well, it's actually less. I'm taking less medication. So we kind of have to talk them through that. But we want to see them at least for 5 sessions, 4 or 5 sessions, and we're going to know, are we helping them? We're getting their brain cycle open. That should stay. Their brain cycle should keep, moving in that direction of expanding and getting, longer. And that's going to tell us whether, CFT is going to help with their migraines and headaches or whatever condition they have going on.
So they come in and they're lying on a massage table, typically on their back. Sometimes they're seated. We could work seated. We could work standing, actually, fully clothed. So it's not like a typical massage type of a situation. Mm-hmm. And we're using our hands to feel into the tightness, to feel into the fascial strain. And then here's the key, we're following their body. Where do they want to go to release that strain? So there's nothing forceful. There's nothing manipulative. There's no standard protocol of this is the migraine. And so these are the 10 steps that we're going to do. It's a very gentle listening approach. And that is why, winding it back to the babies, we can work on babies in a NICU, the most fragile population that we have, or the elderly, because we're truly listening to where their body wants to go to reach that state of homeostasis and healing.
Yeah. And just so, I mean, this is going to be it feels like a very basic question, but when we talk about craniosacral and fascial therapies, the fascia is this like network of, it's a thick tissue that runs throughout our body. So when we talk about manipulating fascia, using a gentle technique, am I assuming correctly here that the time and what your hands feel is what's guiding you, and you say, okay, like this feels a little bit more restricted, so let's go that way, and let's kind of follow this through the spine or this through the jaw. Am I understanding that correctly? And then your hands are sort of releasing that tension. Is that what you mean by letting the individual guide you?
Yeah, sometimes we can feel the strain or the tightness under our hands, almost like sometimes it's like you're molding clay. You can feel that motion under your hands. You may not see something happening. Other times there is a actual visual unwinding of the neck moving or the leg moving in a way, and the body is almost stretching itself out. I mean, we're not stretching them, but it may appear like that.
Right.
So it can be a very kinetic type of a movement to release, or it can be a very quiet looking. And sometimes it looks like nothing has happened visually,
right,
but they will come back and they will report something. And it's, it's always funny too, if you have like a kid on the table and like you don't see a whole lot happening, the parents in the room watching, and then you get the text the next day like, oh my gosh, I don't know what you did, but we need to schedule again because they've noticed these changes.
Yeah, absolutely. But I'm sure there is that element of people get up off the table and they feel some difference.
Oh yeah, absolutely. Yeah. Absolutely. So like Holly said, people always say, well, how many times do I have to come? Like they want a program, and we don't know. Sometimes it is one time, and sometimes it can be a little bit longer. But I will say to my clients, let's plan for at least 4 sessions. I'll say 4, because I know that in about 2 or 3, I'm going to know, are we making any progress? And if there's just no progress, maybe it's not related to fascia. Maybe it's something else going on for them. So then we can kind of have a discussion. My goal is always to move people through. Right. Barry would say it's a bad business model, but it's awesome because you get people feeling better, and they can go on and they know that you're here if you need them. I have some people who are they're on my calendar every month because life continues to happen, and they want to make sure that they're just staying ahead of it. They feel good having sessions. So, it's really up to the individual at that point.
Yeah. Can you guys provide, you're going all around the country teaching, and so there are now CFT providers that should be accessible in most states. Is that correct?
Yeah, that's what we're working on.
We're working on that. Yeah. We have been teaching since 2015, and we were getting lots of requests for providers. People would email us. And of course, at this point, when we have a class every month with 40 people in it, we can't really keep track of where everybody's from and what they're doing. Right. So we really want people to have taken the foundation training, which you have to take before the infant. And if you're going to be working on the infants, you need to be, to have taken the infant training. And we want you to have a license to touch of, in your state and whatever your scope of practice is. And we want you to have insurance. And so we do teach to anybody, because we do have sometimes parents show up that have, kids with some pretty serious conditions, brain injury. It's hard for them to travel. And so we are able to teach parents to be able to work on their own children as well. But mostly we're teaching, OTs, PTs, chiropractors, dental professionals, midwives, birth professionals, massage therapists. So that's generally who we're teaching. And we do have a directory. We have a practitioner directory now that we just launched, I guess, in the last couple of months. And so slowly people are, getting added to that directory. So the idea is that they could go on there and find people in their area, find a CFT practitioner.
That's great.
These are practitioners who are choosing to be part of the directory, to advertise their business in a way that people can find them. And they may also be a speech therapist, and they also may be a lactation consultant. So it kind of gives, a good place for people who want to promote their practice, and for people who want to look for somebody in their area and maybe has another type of specialty to find each other.
What was that resource again?
So that's our website is craniosacralfascialtherapy.com. And then on there's a directory tab.
Okay.
And you can go there and put your search in.
That's great. I'm gonna give a little plug for you guys. When we first talked, I heard something in the way you spoke about CFT that parallels how I communicate, which was this sense of you had something that was really impactful and you were seeing it change people's lives, and you had this excitement about what you're doing. And that in large part, that's why I said, okay, I got to have you on the podcast to share this. We have people from all over the country that listen to this. And so if they can find a provider that specializes in CFT, I mean, it is different than what we do, but the thing that we're both hitting on is the physical component of the headache and the migraine. And it's the thing that's overlooked in our healthcare system. I mean, these people are just getting medication after medication. And so when we overlook the dysfunction and the tension that they're carrying throughout these systems, yeah, it's a disservice to them. And so any provider that's entering into this and doing it well, I think will have that sort of that sense of responsibility to keep sharing it, and in your case, teaching it. And so I really appreciate what you guys are doing in giving people like a real solution, something objective that you say, here's something that's wrong, and we're going to work to fix it. And then they find the relief from that. And I'm sure they're getting their lives back. And you guys, I know, love your job because of that. So thank you for the work you do.
Well, thank you. Thank you for having us, because it's really about getting this information out to people that we can, like you're doing, we can help them get to the root cause of these headaches and migraines, and not just mask it and help them manage their lives. I also will find that that person that shows up with the headaches and migraines, and they don't feel like exercising, and they don't want to cook a healthy meal, and they don't want to get together with friends, and they barely get by at work. And then all of a sudden you hear, oh, I got back to yoga. Oh, I'm out walking my dog. Oh, my husband and I are going on a trip. They're able to get their life back, and they're all equally very important components of health.
Right.
So it can all help build. And so Holly and I like to always say, a lot of times we are that missing piece. We never claim to be the only piece. Sometimes we are, but a lot of times it's just all those other components together that can help people get their lives back.
Yeah, and I'm with you. I believe the physical component can be like 100% of what's happening for a lot of people. So even though like the body experiences pain in a kind of multi-system environment, but any last words? Anything like potentially like practical tips or tricks for people before we close out here?
Well, we don't really give people homework, so to speak. So yeah,
that's fine. That's fine. I think one thing
go ahead.
I was going to say one thing I think would be helpful, and I think you've already hit on it, but as a parent looking at the kiddo and trying to understand, I feel this way, or my kid's feeling this way, and saying, when you see that, this might be what's happening there. That alone can be the most practical and helpful thing.
Yeah, your kid may be tight. You may be tight. And that may be the source of so many different issues that you're struggling with that no one's been able to tell you the reasons why. So if there's anything I would say to people, like, what can you do now? One, go and see if there's a practitioner in your area and go for a session and see what you think.
Yep.
We're available if anybody wanted to reach out to us. We can maybe help direct you, or at least point you in the right direction. And consider taking the class. If you have a family and you want to have a tool that you can use to help your family and your friends, consider joining us in a class, because we do have quite a few parents, and many times those parents actually go on and find a path to a career with this as well. We've had moms who, on the other side of raising kids, which was my situation, decided that they wanted to do this as a career and took on massage school or whatever it is that they needed to do to continue on with this path. Yeah. But you can also email us at info@craniosacralfascialtherapy.com if you have anything specific you want to run by us. We're happy to help any way we can.
That's fantastic. If you're listening to this, I know that was extremely helpful. Visit the website, reach out to a CFT certified therapist. Thank you all so much for listening every week to the Headache Doctor podcast, where, as always, it's our mission to educate and empower everyone with headaches and migraines so you can break free from a life of fear of your next headache or migraine and dependence on medication. We'll see you next week.